When choosing where to live, many people think about how far away they are from a grocery store, a movie theater, or like a school. But many people don't think about how far away they are from a dental office. Uh, According to a survey by the Kaiser Family Foundation, only 42% of Kansas residents have their dental needs met. That is less than half of the people in Kansas without proper access to dental care. According to another survey by kansasdental.com, out of the 105 counties in Kansas, 99 of them do not have enough dentists to support the population. So I grew up in a small town in Kansas where the closest dentist was an hour away. Now that might not seem like a ton, but there's even smaller towns out in western Kansas that it takes people 2 or 3 hours just to get to the closest dentist. Um, Now this makes it just incredibly hard just to go get a regular dental checkup. And that just makes it even more difficult to maintain your overall oral health. According to an article by the Huffington Post, tooth decay or cavities are still the #1 chronic disease affecting children. One reason for this is because only about 1/3 of the dentists accept Medicaid. But another huge reason for that, or an even bigger reason for that, is that people live in areas where dentists are few and far between. In fact, since 2000, the number of people living in dental shortage areas or dental deserts has nearly doubled from 25 million to 49 million. So what's the solution? What can we do? Well, many states have already begun allowing a mid-level dental provider, also known as a dental therapist. Think of a dental therapist kind of like a nurse practitioner, kind of the mid-level. In Kansas, dental hygienists like myself have been pushing for a bill to allow for dental therapists to become a job. So House Bill 2139 was introduced a couple of years ago into the Kansas legislature, and that would allow for dental therapists in the state of Kansas. It's kind of stalled each time it's come up just from pushback from the ADA. According to the Kansas Dental Project, establishing dental therapists will create jobs, ensure that all Kansans have access to regular dental care, and it'll save them money. Now, physician assistants and nurse practitioners have already addressed kind of the medical workforce shortage, and dental therapists will do the same for the dental workforce shortage. Now, dental therapists, there's a few restrictions on what they can do, but they will be required by law to work under a dentist, but they can work remotely, so they still answer to a dentist, but they can work in these underserved areas where the dentist doesn't have to be with them all the time. They'll be able to provide preventative care like cleanings, they can do simple fillings, and they can even do some simple extractions of teeth. Another great thing is that dental therapists will be required to work for a dentist that accepts Medicaid, so they are serving those, the underserved children population, all that sort of stuff. So they'll be able to go to those places that people have to drive 2 or 3 hours just to get to the dentist, and they can go directly to them and provide some dental care to them. Now there are several other states, including Alaska, Oregon, and Washington, that have seen great results from the implementation of the dental therapy bill, and I think. And it even says, according to an article in Reason.com, that dental therapists are perfect for the underserved populations. And that according to the Federal Trade Commission, they've even urged dental schools to make way for a mid-level dental provider. And the Federal Trade Commission goes on to say that dental therapists will increase the output of basic dental services. It'll enhance competition. And it'll reduce costs, and most importantly, it'll expand the access to care for those underserved areas. Really, honestly, I don't see a reason why the bill hasn't gone through. There's been a lot of pushback from the ADA, which is the American Dental Association, and it's mainly pushback from those dentists who think that dental therapists will take their jobs, take their money, take their patients. But really, it's them kind of being more ignorant to the bill itself, not knowing that uh, under that bill, dental therapists will have to work with a dentist, and they must be in those underserved areas. For example, Johnson County, a county in Kansas, has one of the highest populations of dentists in that area. So they would not be allowed to work in that area because it's basically an overserved area. They would be pushed out to some of those more underserved areas out in like western Kansas. Now they could still work for a dentist in the Overland Park area, like the Johnson County area, but then remotely we'll have to serve those underserved populations. Uh, and I just think, seeing as it will increase access to care for many people, and it'll help people keep, just help them so they can actually have regular dental checkups. That's a huge thing to keep people healthy overall. I really hope one day we can kind of look back and think just how crazy it is that people had to drive hours just to get one simple checkup or one simple filling. And I really think it's just a matter of time before people realize that this is a bigger problem, and that we just definitely need to make room for dental therapists or some sort of mid-level provider to provide more access to more people.